Good afternoon, everybody. We're just giving it a couple minutes for folks to join. All right, well, good morning and welcome. Thank you for being here today. I think before we kick off our conversation around the governor's proposed budget, I'd like to just take a moment to recognize and celebrate the one-year anniversary of the Master Plan for Aging. For those who may not be as familiar, the MPA is an ambitious 10-year systems transformation plan that aims to uplift California's older adults and people with disabilities through meaningful policy change. It outlines 5 bold goals and a number of initiatives focused at actualizing the principles of the MPA, and includes a local playbook component that brings the MPA vision to communities across California. The California Collaborative has been a driving force in aligning consensus around LTSS policy priorities and practices. And thanks, Nancy. If we can actually go to the next slide, that'd be great. Thank you. Many of our partners participated in the robust stakeholder process to develop recommendations, working tirelessly as members of the Stakeholder Advisory Committee and subcommittees. And as the MPA moved towards implementation, our regional members rolled up their sleeves to bring the local playbook to their communities. In 2020, they hosted 23 local forums across the state that collectively brought together over 3,000 advocates, policymakers, and community leaders to discuss how they plan to incorporate the MPA's principles in their community. Members also participate on a range of advisory committees at the state, including the Impact Committee, which was established as part of the implementation plan. I'd like to just take a moment to thank California's stakeholder community for their engagement and unwavering commitment to older adults and people with disabilities. And I'd be remiss not to recognize the tremendous amount of work undertaken by the MPA team at the California Department of Aging. As you all know, CDA facilitated the stakeholder engagement process under the leadership of Kim McCoy-Wade, who now serves as the Senior Advisor for Aging, Disability, and Alzheimer's at the Governor's Office. We advocated for an aging and disability SAR for many years, and I think I speak for the entire collaborative when I say that we're all thrilled that Kim was appointed to serve in this capacity. And CDA is the primary agency overseeing implementation under the direction of our friend and former collaborative colleague, Director Susan DeMorris, and the CDA's incredible project director, Amanda Lawrence. Just a quick thank you to the governor for his vision, Secretary Galley for his guidance, and a range of administrative leaders, some of which are here today, who are working in a cross-department collaborative fashion to make the MPA a reality. Last week, the MPA's first annual progress report was released, and if you haven't had a chance to dig in, I encourage you to check it out. The 50-page report highlights major accomplishments and milestones achieved in the first year, and it's really humbling to reflect on the incredible body of work that was accomplished thus far. But we know we have a long way to go to make the Golden State golden for everyone who is aging. And the California Collaborative looks forward to continued engagement and partnership as we continue on this journey together. So let's get to work. And with that, I'd like to turn it over to Athena Chapman, President of Chapman Consulting and the California Collaborative's policy arm, to introduce the governor's budget overview and our esteemed panel.
Great, thank you, Maria. We're just going to do kind of a quick high-level overview. We're lucky to have the experts here with us today from 3 different departments here in the state to talk a little bit more about the specific pieces of the budget that fall underneath their purview. And so, as you will see, we have Joseph Billingsley from the Department of Healthcare Services, Thomas Cameron from the Department of Aging, and then Claire Ramsey, also a previous collaborative member, now at the California Department of Social Services. So we'll introduce each of them again as they jump into their presentations, but I'll just give kind of a high-level overview to kick us off about what's happening here in the state budget. So just a reminder, I think most of you know this, but January 10th, the governor released his proposed budget for this next fiscal year. And then in between now and May, there's lots of negotiations and working with stakeholders in the legislature and the departments to come up with what is referred to as the May revision by May 15th. And then by June 15th, the legislature must pass a budget bill. And then the governor must sign it by July 1st in order to start the state fiscal year. So we're right up and running here in this almost end of January, moving into budget times. So some quick highlights from the budget, which as you can see is approximately $286.4 billion. Some of the big actions that the governor took was to take immediate action, asking the legislature to take some immediate action around COVID-19. And so there was a $1.4 billion to respond to the immediate needs related to the Omicron surge, which hopefully we're starting to get on the other side of here. A $1.3 billion for pandemic response through the rest of the year. So again, we still see that lens of the pandemic impacting budget priorities this year. There is a state budget surplus again, which is estimated by the LAO to be $29 billion. Other estimates from the administration are slightly different. Either way, the state is in a budget surplus, which is always a better place to be than not having enough money. And what that does is it actually triggers the state appropriations limit process, which limits the use of excess revenue funds by the legislature. So that gets pretty wonky, but it is just good to know there are some rules around how they can spend and how much they can spend out of this budget surplus. So some of the other big ticket items that we'll hear more about from our panel related to funding for Medi-Cal. Of course, the CalAIM initiative has been hot on everybody's mind and all over a lot of the work that you guys do. So there was some significant funding around CalAIM implementation. There was a heavy emphasis on health equity proposals and making those changes throughout our system, both in Medi-Cal and more broadly in the aging and disability space. There's the HCBS spending plan and several HCBS waivers, which we'll hear more about. And definitely the collaborative has been following that and some of the data transparency funds that will be available, which is something that has been very important to the collaborative over the last several years. And then additional big budget items, of course, climate crisis, homelessness and housing, behavioral health, public safety, education, cost of living adjustments, looking at ways to bolster the state's infrastructure, and lastly, the creation of the Office of Healthcare Affordability. So lots in there. Those are just kind of the big highlights, but I really do want to give you the opportunity to hear from the panel with more specifics about what's going on with their budgets within these departments. So we're going to kick it off with the Department of Healthcare Services. Really lucky to have Joseph Billingsley here again. He has joined the collaborative before, and we're excited to have him back. He is the HCBS Policy Branch Chief in the Integrated Systems of Care Division at the Department of Healthcare Services, and I will pass it off to you, Joseph. Thanks for joining us.
Perfect, and can everybody hear me? Excellent. So good morning, everybody, or actually, I think it is now afternoon, so good afternoon. Always a pleasure to be able to come and participate in a collaborative meeting. So thanks for having me back again. And today I'll be walking through the budget highlights for the Department of Healthcare Services. And just to give a quick overview of what we'll be talking about, we'll give a general budget overview, speak to some of the major budget issues and proposals, also walk through some additional items of significant interest for this group, and then also briefly walk through behavioral health initiatives and COVID-19 proposals. So next slide, please. So just provide a starting general overview. The budget for Department of Healthcare Services supports vital services that reinforce the state's commitment
Oh,
The budget
Joseph,
proposes.
we may have lost you for just a second, but it looks like you are back.
Can you hear me again?
Yes.
Okay, perfect. So for fiscal year 22-23, the governor's budget proposes a total of 138.3 billion and 4,444 to support of DHCS programs and services. And of that amount, 1.3 billion funds state operations, while 137 billion supports the local assistance, which is funding for our program costs, partners, administration. Next slide. And actually you can skip forward 2 slides. Thank you. So going into our budget issues and proposals, first is expansion of full scope Medi-Cal. So the department is proposing to expand full scope Medi-Cal coverage to all adults, regardless of their immigration status. The proposal would expand coverage to an estimated 700,000 undocumented adults aged 26 through 49, and that would be effective no sooner than January 1 of 2024. And this expansion is expected to result in 819 million total fund, of which 614 million will be funded through a general fund. And with this expansion, full scope Medi-Cal coverage will be available to all otherwise eligible Californians, regardless of their immigration status. And we're also going to be proposing trailer bill language for these changes. Next slide. Next up is California Advancing and Innovating, or CalAIM. And we just wanted to highlight a couple pieces within this for purposes of the 22-23 budget. One is the justice package, where CalAIM Justice Involved initiatives support justice involved individuals by providing key services pre-release and enrolling them in Medi-Cal coverage and connecting them with necessary behavioral health, social services, and other providers that can support their reentry. Also, another key area for focus for CalAIM in the upcoming budget is our Providing Access and Transforming Health, or PATH funding. And PATH will provide funding to community-based organizations, counties, and other local providers to support capacity building as they begin to implement and scale the enhanced care management and community supports products developed for CalAIM, in particular, increasing resources available to populations and communities that have been historically under-resourced and underserved. PATH will also support justice-involved individuals or adults and youth by post-release services. And specifically, within the budget is 1.3 billion total funds over 5 years to support the development of enhanced care management and community supports in CalAIM. Also included in the 22-23 budget as part of the CalAIM initiative is the foster model of care. So moving on to the next slide. I'm sorry, give me 1 second, I pressed the button in it. Okay, I just had to adjust my screen real quick. Thank you. So next up is the additional items of significant interest. And wanted to start with our proposal to transition some of our Proposition 56 payments to ongoing general fund support. So the budget does propose to fully transition the following payments to ongoing rate increases supported by the general fund beginning in 22-23. And just to call out a few of those, these include the AIDS waiver, or Proposition 56 payments are funding that was used to fund rate increases for the AIDS waiver, for community-based adult services, or a CBAS program, also for home health services. So continuing the rate increases that were funded, the home health rate increases that were funded through Proposition 56. And that impacts both state plan home health as well as home health provided through our waivers, including private duty nursing. Also, the supplemental payments that were funded through Proposition 56 for the intermediate care facilities for the development of the disabled, and pediatric day health care, also non-emergency medical transportation. Next slide, please. Next up is equity and practice transformation payments. So the department is proposing to make equity and practice transformation payments to qualifying Medi-Cal providers. And these are intended to close critical health equity gaps, addressing gaps in preventative, maternity and behavioral health care measures, and addressing gaps in care arising out of the COVID-19 public health emergency. And such payments are intended to promote patient-centered models of care in pediatric primary care, obstetrics and gynecology, and behavioral health settings, and to align with the goals of the Medi-Cal Comprehensive Quality and Equity Strategy. Next slide, thanks. The department's also proposing the elimination of certain AB 97 provider payment reductions. And so in order to address the impacts of COVID-19 and to ensure access to services, the proposal includes eliminating payment reductions for the following providers, and that includes all types of nurses, alternative birthing centers, audiologists and hearing aid dispensers, respiratory care providers, DME, oxygen and respiratory services, chronic dialysis clinics, non-emergency medical transportation, and emergency air medical transportation. Next slide. Additionally, the department is proposing to reduce Medi-Cal premiums to zero. And so the proposed budget does include funding to reduce premiums to zero for programs under the Children's Health Insurance Program, or CHIP, and also the 250% of federal poverty level working disabled program. Next is telehealth. And so pursuant to Assembly Bill 133, which was passed last session, the department convened a telehealth advisory work group for the purposes of informing the 22-23 governor's budget and the development of post-COVID-19 public health emergency telehealth policies. So AB 133, the telehealth advisory work group, which consists of subject matter experts and key stakeholders to advise DHCS in establishing and adopting billing and utilization management controls and protocols for telehealth to increase access and equity and reduce disparities in the Medi-Cal program. In December of 2021, so just last month, DHCS did publish its telehealth work group report. You can find it on our website. And actually, after I finish my part of the presentation, I'll go ahead and post that link in the chat for everybody. And so that report reviewed the policy approaches and work group deliberations. And then as we just closing out there, as the department continues to look towards the future in regards to telehealth, we will be finalizing that proposal to provide final input and direction regarding how we allow Medi-Cal covered benefits and services to be provided via telehealth across delivery systems when clinically appropriate. So next up is the home and community-based alternatives waiver. And so we've been going through a renewal process for this waiver for the last year and a half. Probably many of you were involved in some of the stakeholder processes for that renewal. We did end up submitting our waiver renewal application to CMS. That was submitted at the end of September, I think September 29th, to be exact. And that's requesting a new 5-year waiver term from January 1, 2022 through December 31 of 2026. Was the current waiver scheduled to expire on December 31 of last year, 2021. However, as CMS is still reviewing the waiver renewal application that was submitted by DHCS, they did ask California to request an extension of the waiver term. So it's been extended through March 31 of this year, 2022, to allow for more time, or to allow for completion of the CMS review and DHCS responses and approval of the waiver. Upon approval, the waiver is expected to be retroactively approved to January 1, 2022, and the new waiver term will be through December 3rd, 2026. The waiver renewal application, just some key points that we wanted to flag, key changes that were included in that renewal, and really a result of significant stakeholder work that we did. DHCS is proposing to increase the number of slots available under the waiver beginning in 2024. And so that's aligning with our current growth patterns for the waiver and ensuring that we continue to have capacity for growth within the waiver over the next 5-year waiver term. We're also proposing to expand the community transition service, making it available to participants living in the community who require essential goods and or services to make their community-based residents safe and keep them out of an institution. Currently, we only make that service available to individuals transitioning from institutional settings. We're also proposing to add assistive technology as a new waiver service in the HCBA waiver. We are proposing to add paramedical services as an extended state plan benefit under the waiver. We are also adding pediatric day health centers that are licensed to operate a transitional healthcare needs optional service unit as a provider type for private duty nursing for eligible participants who have turned 21 years of age, and also as a provider type for facility-based respite services for youth under the age of 21. And then lastly, we've also worked to increase the rate paid to personal care agencies that provide waiver personal care services. So that's separate from WPCS through the IHSS CNIP system to align with minimum wage increases. Next slide. Next is skilled nursing facility payment reform. And so basically the department is proposing in the budget to extend and reform the funding framework and to move from a primarily cost-based methodology to one that incentivizes and quality. Let's go ahead and move on to the next slide. And then also we have the American Rescue Plan Act of 2021, through which the state issued California's home community-based spending plan. And so the American Rescue Plan Act of 2021 provides funding to enhance, expand, and strengthen home community-based services in California. Receive conditional approval from CMS for its spending plan on January 4th of 2022. And the state enhanced HCBS funding, make funds available for the state spending plan initiatives. And the HCBS spending plan does include $3 billion in enhanced HCBS and $1.6 billion in a regular federal financial participation across several departments in the state of California. One quick piece I want to point out here from a Department of Healthcare Services perspective, one of the initiatives included in the spending plan is an initiative to eliminate the assisted living waiver wait list, and to do so by adding 7,000 slots to the assisted living waiver. And DHCS did submit an amendment to CMS to add those slots. That amendment was approved at the beginning of January. So those slots have been added to the assisted living waiver, bringing our total capacity to 12,577 slots under the assisted living waiver. So DHCS has put out informative materials related to the approval and is working with care coordination agencies to begin processing enrollments, as well as releasing updated guidance for processing the waitlist applicants. So we're very excited to be getting that process to begin processing today the assisted living waiver again. Next slide. Next, we wanted to quickly outline some of the behavioral health initiatives that were included in the HCBS proposed budget for 22-23. Those include short-term residential therapeutic programs, behavioral health bridge housing, mobile crisis services, opioid settlement and abatement funds for future opioid remediation, and cognitive health assessments. And just to flag also, the slides should be made available for all, and we did include budget figures in the slides. I'm just not walking through each of the budget figures for every proposal. Last but not least is the budget proposals related to COVID-19. So the budget does continue to reflect significant fiscal impacts related to COVID-19. And based on an assumption of the federal public health emergency continuing through June of this year, 2022, the budget does include $13.5 billion in total cost, which include $45 million general fund costs in fiscal year 21-22 and $11.1 billion total funds, which include $2.3 billion general fund costs in fiscal year 22-23. And these amounts reflect the net impact of a variety of factors, which include caseload impact, testing in schools, vaccine administration costs, funding for county redeterminations, the ending of COVID-19 response impacts, and increased federal funding over the FFCRA period. So I think that is probably, I think that's the last slide. Yes, so that is the end of the DHCS updates. Definitely happy to take questions through chat and after, so I'll be monitoring for those. And happy to hand back to Athena to introduce our next presenter.
Great, thank you so much. A lot of good information, and of course we will send out the slides after as well, so people have access. That was a lot of detail in a short amount of time. We appreciate all that great information. Lots of stuff happening. So next, we'll move on to some updates from Thomas Cameron. He's the Deputy Director of Administration at the California Department of Aging. He's going to give us an overview of some of the budget items impacting his department. So welcome, Thomas. I will hand it off to you.
Thank you, and thank you for having me and giving me this opportunity to present on the investments that have been made in the department in the governor's proposed budget. We have this PowerPoint available, and I'm happy for the collaborative to share this post meeting so you guys can have links and this information that I'm about to go over. So in the governor's proposed budget, there were 3 proposals included for the Department of Aging, and you'll see those 3 on my screen. I'm going to focus on 2 of them, since the third is really just a technical adjustment to better align our staffing with our funding and our current expenditures. So that one is a zero cost proposal. It's noted as a technical adjustment with position authority. So I'm not going to focus on that, but I did want to highlight that for everyone as an additional proposal. The biggest proposal that was included for the Department of Aging in the governor's budget was the Master Plan for Aging Implementation Phase 2 resources. This represents $2 million in fiscal year 22-23 and $1.9 million starting in 23-24 and ongoing to provide additional resources via staff positions in some very specific categories: data and research, equity and tribal leadership, some policy leadership, public, external, and stakeholder relations and communications. And then there was one bullet I left off of this, and I do apologize for that, but also around establishing a new state public guardian liaison with the department. So this proposal really does continue to build on the investment that was made in last year's Budget Act, which really provided our first round of staffing and resources to begin implementation of the master plan, which included staffing to establish a new division within the department, the Division of Aging, Policy, Research, and Equity. a new office, which was the Office of the Long-Term Care Patient Representative, and some other additional resources. So this just continues to build on the administration's original investment and provides the department with the resources necessary to continue to implement the various initiatives and to support both the stakeholders and the administration and others as we continue to move through master plan efforts. The next proposal that we received approval and was included is an administrative workload resource proposal, which provides 4 additional positions to the department and additional funding totaling $500,000 approximately ongoing to provide additional human resources and business services staffing. And this really does help align our administrative staff with the growth of the rest of the department with the new positions provided in the master plan for aging proposal this year and in the last year, and really gives the department the staffing it needs to continue to support the growth in these new areas. Again, our last proposal was the technical adjustment. There are some things that are not on here that are new funding for the department, but I think Joseph really covered a lot of that. It's tied to the home and community-based spending plan, and then various other investments that were funded outside of the department that really do benefit older adults in California and really tie back to the various initiatives and efforts of the master plan for aging. If there's any questions or any follow-ups, please let me know. I'm happy to respond. And thank you.
Great, thank you so much. Lots of interaction between departments here with these initiatives. So I'm happy to see you all starting to coordinate that. And we, of course, are very supportive of a lot of these big investments. So thank you so much for that. So next, but certainly not least here, last in our panel, and face that many of you are familiar with, Claire Ramsey, who is the Chief Deputy Director for Disability, Adults, and Housing Integration for the California Department of Social Services. So please join me in welcoming Claire, who's going to give us some updates from her perspective. Thanks, Claire.
Thanks, Athena. I'm really nice to be here today, and I hope everyone's having a safe and healthy start to the new year. I know it has been a very intense time with Omicron in the communities everywhere. So I hope you're all doing well. I'm excited to come today and do my first presentation from the state side of the house. And I'm just going to fix my camera. I feel like you guys are getting a little too much top of my head and a little not enough of the rest of me. And I'm the only one, I guess, without a PowerPoint. So I hope you guys will bear with my talking head on this presentation. So I think most of you know this Department of Social Services oversees a really wide array of different programs. And the two I'm going to focus on are a couple of programs run under our Adult Programs Division, so IHSS and SSI-SSP. And then I want to talk about some of the programs being run through our Housing and Homelessness Bureau. So I wanted to start with IHSS. Are you guys hearing me okay? Somebody just said they were having a little difficulty hearing.
I think you can just a little bit closer to your mic. You were just dropping in out a little bit.
You're going to get a lot of face today. Okay.
There you go.
All right. And I'll talk nice and loud too. So on IHSS, for our 22-23 projected budget, we are expecting an increase and that the program will start being budgeted at $18.4 billion total funds in 22-23. And that is an increase from 21-22, where right now the program is $16.8 billion. Part of that is coming from a caseload increase projection. We're expecting to basically have almost 600,000 IHSS recipients in budget year 22-23. And we also expect that hours will go up, average hours will go up slightly, and average wages will go up slightly. And those two things obviously are not, and none of these things are in the direct departmental control because the program is administered at the county level. But those are the trends we've been seeing over time, these slow growth in all three categories. So the overall budget's going to grow. There are three items I wanted to highlight in IHSS that some of you may be familiar with, but I want to make sure that you're aware. So the first was through the HCBS spending plan, had been flagged as the IHSS Care Economy payments. Those have been approved now within the HCBS plan and actually are on the verge of going out. So by the end of the month, we're hoping more than 500,000 providers will have received a $500 care economy payment. And that is in recognition of their extraordinary work throughout the pandemic. Between basically every provider who worked between at least 2 months between March 2020 and March 2021 qualified for a payment. And so that was obviously a huge number of providers. And hopefully this extra $500 will be, a welcome addition to their wages for this year, and will help them in this challenging time of Omicron. So we're very happy that those have actually gotten all queued up to go out and should go out by the end of this month. The next is the permanent backup system. So that was proposed in last year's budget, but it didn't end up getting finalized before the budget closed in 21-22 fiscal year. So it is now put back into the governor's proposed budget, and basically going to work toward having that all worked out and finalized this year. And so more to come on that, but basically the idea is there has been both at certain counties have run backup systems for IHSS. That's happened throughout the years. And then during COVID, the state did stand up an emergency backup system specific to COVID. And that emergency backup system ended end of last year on December 31st of 2021. But the idea now is to actually stand up a permanent backup system. There will be much more stakeholder engagement on that throughout the spring. Expect trailer bill language to be coming out around it, and more conversations. But we're really excited that that will be an ongoing project, and then an ongoing resource for IHSS consumers to make sure that they are safe in their homes. And then the last thing I just want to flag is actually a connection to Medi-Cal, but I think many of you are familiar with the fact that the Medi-Cal asset limit is about to go up in July of 2022. Right now it is $2,000 for an individual and $3,000 for a couple. It's going to go up to $130,000 for an individual and $195,000 for a couple. And what that's going to mean for IHSS is it means that more people are going to qualify for Medi-Cal, which generally directly translates to more people qualifying for IHSS. So we are expecting to see additional program recipients because of the Medi-Cal asset limit increase. So again, that's going to go up July 1st of this year. And then the expectation is that it's fully eliminated as the resource limit completely is eliminated January 1st of 2024. So again, expect more people to come on IHSS as those limits raise and then get eliminated. So that's sort of the big IHSS pieces. And then I wanted to talk a little bit about the SSI SSP program. So that program is right now projected at 22-23 to be $9.9 billion total funds spent. And we are expecting a caseload decrease in that program, which has been kind of consistent over time. And we'll be serving a little over 1.1 million recipients of SSI. Excitingly, and people have already seen this, the SSI SSP grants went up for two reasons starting January 1st of this year. So one reason was because the budget increased the SSP portion of the grant by 23.95%. And so that added additional money back into SSP. And I think many of you are familiar that there were some significant cuts made during the Great Recession. This is moving us toward a pathway of restoring those. But also there was a federal cost of living increase of 5.9%. So starting in January 1st, 2022, the maximum grant amount for an individual is $1,040.21, and for a couple, it's $1,765.94. So we're really pleased that those increases went through starting 2022. The governor's budget has also proposed an additional 24% increase effective January 1st, 2024, with the expectation to bring the maximum grant levels up to $1,123 a month for an individual and to $1,940 a month for a couple. And those also include an expectation potentially of a cost of living, federal cost of living increase potentially. So that's really exciting too. And those, that second 24% increase will bring us back up to the SSP being fully restored from prior to like all the Great Recession cuts. So that's was a huge objective. And I'm really excited to say that the governor is on track to meet that objective. And so the other piece I want to talk about is the housing and homelessness proposals. And these were actually all funded in the 21-22 budget, but were multi-year investments. And so there's a lot happening around housing and homelessness that's going to be really good for individuals who are older or have disabilities. And DSS has really expanded its programs that serve that population. It used to focus more on children and families, but now with these program expansions, we're really significantly working to help solve homelessness for older adults and people with disabilities. So 3 programs I want to flag are first the Community Care Expansion Program, which is almost $805 million over multiple years. And the purpose of that is to expand access to congregate living settings for adults with disabilities and older adults who need that level of care. So that's obviously not everyone, but for people who need that level of care and who also were prioritizing the SSI SSP population, in part because that's been a population that's struggled to get access to congregate licensed settings because of challenges with having enough placement options for people to have enough beds available statewide. So we're really looking to have people who want to expand access by building new or converting new facilities, who need rehab on maybe current existing households, or want to expand, like they have 6 beds now and they want to expand to 10 beds, you know, so all those things are contemplated. A huge amount of work has gone into this, and it has been being done in lockstep with Department of Healthcare Services on there, and I always have to look this up, Behavioral Health Continuum Infrastructure Project. So the acronym is BHCIP, BHCIP is the DHCS side of the program, and that's additional money separately for behavioral health and housing and community supports. And then our Community Care Expansion Program, CCE, is really looking at residential settings expansion for older adult and people with disabilities. And so there is a program update about all that with a lot more information. I'm going to put that into the chat right now so that you guys can read that. And one of the things to know is that very, very shortly, the expectation is that the RFP will actually be published for this. So we're really excited that that has been moving along really rapidly and a huge amount of work has been done. We think it'll really provide additional support to people who need it, and to communities really being able to look at like what their resources are now and to figuring out like what additional resources are needed in their communities to support the SSI SSP population who is experiencing homelessness or at risk of homelessness, but who also needs like additional level of care to be safely housed. So then the next program I just want to flag is the Home Safe program. And for those of you who aren't familiar, this is a program that has existed for a number of years, or for a couple of years, excuse me, but it got a really significant increase in funding. Last year, that was multi-year. So it was an additional $92.5 million in 21-22, but then also in proposed in 22-23 is an already funded, excuse me, not proposed. We already had a 2-year funding for another $92.5 million in 22-23. And that's really to link housing supports and housing navigation to people who are either experiencing abuse and neglect or are coming into like the APS system, because we were seeing like an increase in homelessness and housing insecurity in the APS population. So that's already like embedded in several counties throughout the state, but this additional money has allowed us to really expand the number of counties who are using Home Safe and also expand to tribes. So that's been really exciting. And then the last program I want to just flag is the Housing and Disability Advocacy Program, HDAP. And that got $150 million in 21-22, and is proposed for another 150 in 22-23. And that's really about blending housing support and navigation with benefits advocacy, and making sure that people who maybe have really low incomes or who are on general assistance or general relief, if appropriately, they need to apply for like SSI or Social Security disability benefits or veterans benefits, that they are basically getting that sort of support to do the applications and to get onto the benefits. And then to also help connect them to housing supports and to permanent housing if they're needing that assistance as well. So really excited about the expansions there. Again, that will, all that extra money will help us serve more people, but also expand into more counties and tribes. So with that, and I did see it come up in the chat, although I couldn't read the long, I want to make sure, I know there was a question about IHSS career pathways, and I actually realized I should have just flagged that as well. That's not a budget proposal from this year. It was something funded last year in the, and it was also highlighted in the HCBS spending plan. There was just a listening session on it yesterday. And I can't sort of repeat that here because I don't have all my slides and I'm not Leora, but basically that is a program that is going to be being built now, and the listening sessions are helping inform, and also we're getting stakeholder feedback and things like that. That's all helping us inform the creation of this program. But what it will basically do is provide 5 different pathways for IHSS providers to take trainings. And let me see if I can do it off the top of my head, but it's there's a health and safety track and an adult education track that are sort of under the basic pathways. And then there are specialized pathways, one around housing and homelessness and working with that population for the IHSS providers, one around cognitive impairments and behavioral health, and one around significant physical disabilities. And those specialized tracks are really hyper-focused on IHSS consumers with those needs. And so the trainings will be free. People will be paid for their hours of trainings. And if they complete up 15 hours in any of the pathways, they will be eligible for an incentive payment. The amount of the incentive payment isn't known yet. We're still working on all those details, but so if you take 15 hours, you will get an incentive payment. There's no limit on that. So you can take multiple pathways. You can take 15 hours and then another 15 hours in the same pathway if there's additional classes you want to take and get another incentive payment. And then there are 2 other separate incentive payment structures. That one is if you take a specialized pathway and then go work for a recipient who has those needs, who's new to you. So you're taking on a new consumer. And if you work 40 hours for them for at least 1 month, you will get an incentive payment. And if you continue to work them for 6 months, you will get a second incentive payment. So that's really us trying to think about how to both recruit and retain IHSS providers in the program. And part of that is with the training support, and then part of it also with the financial support. And then with the basic pathways, it is also to support IHSS providers and make sure they feel secure in the work they're doing, but also it will link in potentially if people want to pursue other pathways in terms of, becoming a CNA or becoming an RN or becoming a social worker. It's also trying to help basically support those more complex career ladders and different workforce initiatives that are actually happening across several different departments and agencies. So thanks. I hope that was answered most questions, but I'm happy to answer more. With that, I turn it back over to Athena.
Great, thank you so much. A lot of information and impressive. Do it without slides off the top of your head. So we can tell that you've been busy, Claire. So thank you so much. Thanks to all of our panelists. We will now move into the Q&A session. If you all want to put your cameras back on, I think we have things for most of you. And I know that the chat and the Q&A have been filling up, so please continue to put questions in there. But I will just start with one for Joseph about a question related to plans for the assisted living waiver. You talked about filling some of the, wait list spots and opening up that capacity. But is there a plan for the assisted living waiver, more long-term to become statewide, part of a bigger waiver program? Folks were interested in that.
Definitely. I can speak to that a little bit. And that's something that was discussed quite a bit during our both our stakeholder meetings and our technical work group process that we went through for the home community-based alternatives waiver recently. And so that is something that the department is towards working to implement. We've talked for a while about integrating the assisted living waiver and assisted living waiver services into our existing home and community-based alternatives waiver. We have looked at doing that potentially originally with this renewal of the HCBA waiver, but that was put off track a little bit by things like the COVID-19 public health emergency and pandemic. So what we've done is, because we're in the midst of the current assisted living waiver term, and that's scheduled to end about midway through this new HCBA waiver term. The assisted living waiver will be in February of 2024. We are planning to align the expiration of that waiver term with the integration of assisted living waiver services into the home and community-based alternatives waiver. And we think that's necessary because we some of the conversations in the technical series for the HCBA waiver about what that would look like and what that would entail. We realize that there is a lot of work to be done around with stakeholders, just around, identifying what that does entail. Like, what does it mean to move those services into the waiver? How does that impact existing assisted living waiver service providers? But ultimately, the goal is doing that. And we see the HCBA waiver as the right vehicle because it is a statewide waiver, unlike the assisted living waiver. And that'll give us a process for transitioning the assisted living waiver and making that statewide as well. So we see adding these slots through the plan initiative as an initial step to allow us continued capacity to grow the waiver, since we were at capacity interim, and then setting us up for doing the stakeholder work necessary to then be ready to integrate assisted living into the HCBA waiver, aligning with the expiration of the current ALW term.
Great, thank you for that. Sort of a pathway, Core. Folks are happy to hear they'll be expanding, I'm sure. So thank you for that update. So I know there was some discussion about the funding increases for HICAP, and I think, Thomas, you put something in the chat and some resources. So if you want to just kind of quickly summarize that for the group, and I will just let everyone know there's some links in the chat there that Thomas put that are also helpful.
Yep. So I got a question from Tatiana, and she was asking about, will there be any additional funding increases for HICAP? So I'll just quickly go over what I put in the chat. The current budget actually includes a new investment for HICAP that is new to the department. It represents a 2-year limited term increase in funding. But in addition to that, we also added some budget bill language that provides some additional flexibility to the department to continue to increase the level of funding for HICAP over that 2-year period as well, outside of the standard budget process. So that initial investment really focused on modernization around HICAP data operations, some fiscal operations, training, as well as increasing local resources for volunteer coordinators. So as we continue to work with stakeholders and partners on what the long-term goal for modernization and changes to the HICAP program, we have a vehicle and a mechanism outside of this formal budget process to go to the Department of Finance and to state, hey, we have this initiative and effort we'd like to fund. There's enough additional funding in the special fund that HICAP gets, and we can draw down resources from that and fund those efforts and initiatives as they're ready to go and get kicked off. So that's where we're at with HICAP at this point in time, but happy to answer any additional questions, and we'll obviously continue to keep you posted as that may change.
Okay, great. Thank you so much. So I think another question that came in, and I'm not actually sure who this is for. So anyone can speak up, was about funding for cognitive health screens and if there's additional funding available for that. Somebody hit on that. Okay. Well, we'll have to look into that some more. It was something that I think came up, but I didn't hear it from one of you, so I wasn't sure who that went to. So we'll follow up on that one. So another question that came up that has to do with IHSS, Claire, there was a couple, but we'll start with the public authorities having access to IHSS training funds. I know you went a little bit into sort of how those training funds might be available, but it seems that there was some public authorities interested in how they could access those.
Yeah, I don't have all the answers right now, but public authorities, so there are certain entities that are allowed to be vendored for the training program. Public authorities and counties are two of them, and nonprofits and Taft-Hartley organizations. I think those are the four, but if I've forgotten something, I apologize. It's laid out, there's statutory language around all this and it's laid out there. So there will be ongoing information coming from the department and discussions about, how to apply if you're interested in doing the trainings, what type of trainings we're looking for, what kind of curriculum we're looking to fill out for each of the pathways. So all that's being built. And I realize I didn't say this in my little summary, but we're looking to launch like September, October of 2022 with the actual training program. So we're going to be spending the next several months like continuing to build the program and to get it launched. So more to come, and the PAs should always feel free to reach out to the department if they have specific questions around timing or what's coming next. But definitely we'll also be reaching out to you because we know that you may have interest in providing trainings. You may already be doing that and want to continue that through this program. So that's all definitely contemplated.
Great, thanks, Claire. I'm going to wrap back around to you, Joseph. So it did appear that the cognitive screening question was a question that came from one of your slides, and if there's additional funding for that. And then I have a separate question for you after that, but I wanted to wrap back around.
So where is that question?
It was in the Q&A, which I don't know if you can see, but it was just a question around elaborating on the funding for the cognitive health screens. It was one of your slides. And we can follow up later.
Yeah, you know what? Let's follow up on that one. If you can send me the question, then we can get a response back.
Sounds great. We'll do that. So I have another question for you around the CBAS centers and sort of funding for making them safe as folks are returning, to in-person, but still recognizing there's some challenges related to COVID and the public health emergency, and specifically around access to rapid tests so that people can take those tests before going to a CBAS site or other congregate setting, and then funding around mitigation efforts, right, so that they can create social distancing, make updates to infrastructure. Is there anything sort of envisioned in your understanding in all of this, all the funding that's coming this way to deal with some of those issues?
So I think, definitely in general, looking at where there are opportunities there, but when we say specific to CBAS, I know that there are some proposals that are being looked at out there from the perspective of, like, I believe CADS is working on or looking at a proposal. I don't know. I'll definitely see also if Thomas at Department of Aging has anything to share there as well. But I think, definitely in general, when we're looking at funding we have related to COVID-19 and how we're applying that, how that can be applied to address issues across programs, but nothing specific in the budget that is targeting like CBAS specifically at this point, but definitely we'll be looking at that.
Great, thank you.
Yeah, and I can just jump in from the CDA perspective on that. This was the proposal that Joseph mentioned from the association was actually just shared with our department recently, and we're looking at it kind of in the same vein, looking to see if there's any existing federal COVID funding or COVID resources that we have received that could be used to help CBAS centers address some of those issues. And then also continuing to work with the administration and our partners at the HCBS on other potential ways, if that's not an option, on how to address this proposal and fund some of these efforts, but more to come.
Great, thank you. And then Thomas, we actually had a follow-up question about your authority for the special fund, and if that fiscal authority goes beyond the 2 years, or if after that might create a cliff.
So the way we wrote it and intended it, it was to cover the initial 2-year period. And the reason why we did that is because we really want to leverage this 2 years and that initial flexibility to really address the concern of the growing balance in the high cap special fund, and also to really go back and look at the funding methodology and some of the way things are calculated and set up for high cap, to ensure that, one, we're funding at an appropriate level, two, that we're keeping pace with changes to our population and changes to our needs, three, we're really working to fund high cap and to provide the resources needed to move in the appropriate direction that aligns with the master plan and CalAIM and other efforts. So our goal is to hopefully, by the end of this 2 years, have a new funding methodology and structure and be able to get that approved via a more formalized budget change proposal that'll then address the growth in population and the growth in the special fund balance, and set us up so we can continue to draw down an appropriate rate and really not see funds just sitting there not being used and applied to really address some of the needs around the high cap program. So that's the goal, and that's what we're working towards. I know Denise and her team here at CDA have been doing a lot of work with my staff and stakeholders to really start looking at how we're going to implement that. So more to come on it.
Great, thank you so much. Okay, Claire, a couple of IHSS questions. So one is around sort of efforts to, there's sort of 3 pieces: more timely payment, increases in wages, and consistency across counties and benefits. So one question with 3 in it.
So in terms of payment, one of the things that I know has really sped up payments is our move from a paper timesheets into our electronic timesheet system and telephonic timesheet system. And we really are seeing payments are happening much more rapidly, and there are less errors because obviously there aren't things like kickback, like did you write a 6 or an 8 physically on this timesheet? You know, when you type it in, it's all very clear. So if somebody's not enrolled in one of those systems yet, we really recommend, almost everyone is, like the vast majority now of the state is enrolled in one of the telephone timesheet or electronic timesheet systems, but that's really increased how fast people get paid. We're also working to get people onto direct deposit, and that's another way to really hasten payment. And so the counties and the state are working to make that happen and to get everyone to move over to direct deposit. In terms of the living wage, I mean, I think that is an ongoing conversation in terms of wages. Wages are negotiated locally, not at the state level. So that's a piece of it, right, is what's happening locally. But we are seeing, for example, this care economy payment that's being issued by the end of the month for $500, and then the incentive payments and the paying for training as also being other ways to make sure that we are appropriately reimbursing and compensating people for their time and work. So hopefully that will help people, you know, feel that their income is being, you know, more, their income is increasing through those efforts. And then in terms of timely accountability, I'm just looking at that last question. I would say for this particular person, if they would like to send me an email with some specifics around what's happening in Orange County, I'm happy to take a look. There is a rule in place already that the counties are supposed to do a preliminary assessment while somebody is in a facility. So that rule is correct, and that does exist, and that may be why you're seeing in other counties. If Orange County doesn't seem to be doing that, the department would like to know, and then we can always work with Orange County or any other county to make sure that the rules are being properly enforced. But you know, if there's specifics, I'll put my email address for the person to send me an email.
Great, thanks, Claire.
Thanks.
So Joseph, quick question for you related to IHSS. It looks like people were wondering about the IHSS dashboard, which looks like it lives at DHCS, and whether that will be updated. It looks like it has not been updated for a while. Do you know, or can we take that question back?
Let's take that question back.
Okay.
Please send it over to me and I can do some quick research and
Great. Figured you weren't up to speed on every single website update that's happening
all of them.
across the department. But we have to see if we can get the information while we've got you. So thanks for that. So another question, I think this is for Claire. With the SSI PNP increase impact eligibility for CalFresh? There's some unintended negative consequences maybe there.
I don't know that answer off the top of my head, but that's when we can get back. Was that, I'm sorry, I saw that question in the chat, but I missed. Who was that from?
Go back and look. We can send it to you. And
Okay,
follow
yeah,
up.
let me connect with the team to see if if there's already been a calculation made to see if there would be negative impacts or not, and then we can.
Okay.
On that.
It looks like it was Christina Mills, but we'll share with them.
Yeah, Christina, we'll get you the answer on that.
Yeah, great. Thank you so much. Okay, so it looks like there's some other questions around the HCBA waiver. And it looks like there's some questions around what is referred to as a requirement for a circle of support. And so how that may be maybe ending up in some barriers to care. I'm not sure, Joseph, if you are familiar with that or have any thoughts on how that requirement is supposed to work. But if you can speak to that a little bit, that would be great.
So is the question around whether a circle of support is required? I think, and definitely, please let me know any follow-up questions, but in general, it has been a requirement in previous iterations of the waiver to for the participant to have a circle of support in terms of identifying how they'll be supported outside of services are being provided. That is something that we did work to update during the most recent renewal process, just providing some clarifications in there, recognizing that the waiver is still available to support individuals when they don't have a circle of support, because there are individuals that don't, that aren't going to have a circle of support at all, or as full a circle of support as others. So while the waiver still needs to identify what is an individual circle of support as it is available, enrollment in the waiver does not require a circle of support. And so that's verify so that it's not looking like the waiver is excluding individuals that don't have as much supports as others.
Okay, great. Thank you so much. So we do have one more question here, and I will admit to not knowing all of these acronyms, so I'm not sure who this is for. But the question has to do about addressing the gap between the levels of fixed income for older adults and persons with disabilities and the AMI, and 30% of AMI to accommodate housing, but now it is falling to 5 or 10%, which is pricing people out of low income housing. Like maybe that's a Claire question.
Yeah, I don't know that I have an immediate answer for such a big question around like, how to get to area. I think AMI stands for, is it area median income, I think, but forgive me if I've got my acronym wrong. But I do think our housing programs, two things, our housing programs within CDSS are really trying to work on a variety of intersections between housing and supportive services, and also thinking kind of creatively about what housing supports might be needed to keep someone safely housed and get them into the housing. So some of our programs are a little less focused on some of the what you might be thinking of like HUD subsidized housing criteria. But we also work with our partners at our housing agency and HCD to work collaboratively, since they're the ones administering the subsidies. So I don't think there's any simple, straightforward answers on this, but I do think a lot of thinking is going into how do we support low-income older adults so they continue to live safely and be able to actually live in the state, right? To be able to stay in California. I'll just mention that actually it's just starting literally, I think at 1 o'clock today, is the California Interagency Council on Homelessness. it basically has sort of relaunched. It had another name before, Housing Council, Homelessness Council, I'm missing it, Homelessness Coordination and Financing Council, I think. It was like HCFC. Thank you. I see head nods from my colleagues, I appreciate. That's morphed into the Cal Interagency Council on Homelessness. And so that might be a place to bring some of these concerns. This will be basically chaired by both the by the Business Consumer Services and Housing Agency. And I really appreciate all the nodding as I'm getting all my acronyms down as a state employee, and our Health and Human Services Agency Secretary. So those two secretaries are chairing it, and there's a ton of participation from a bunch of different departments. So I think, again, that'll be a place and space to talk about some of these concerns and issues, along with many other forums that I know are happening around this.
Great, thanks, Claire. And Joseph, it looks like we have a question around just confirming your statement about not turning people away from the HCBS waiver, and you know, the department can consider making sure that's been communicated to service providers. So I think just a request, and if you have any thoughts on how that happens, please share.
Yes, no, definitely. This is something that, again, we, you know, was discussed during our work group process. It's something that we've looked at and worked to clarify in the renewal as part of the renewal submission. But coming out of that, definitely we want to continue making that, providing that clarity to providers. I was just going to respond in the chat that that's something that we can add just as a point of emphasis to our upcoming February waiver agency meeting. We have a monthly meeting with all of our waiver agencies. That'll be at the beginning of February. And so we'll add that to the agenda to make sure we're helping to communicate that point. And then also as the, that will be reflected in the final approved waiver, but we can help in making sure that policy document or clarification is clear. And please, if you're hearing instances of that occurring, feel free to reach out to me. I can put my email address in the chat. Definitely, that is something our team can follow up on.
Great, thank you so much for that. And it looks like one last just clarification for Claire for the recipients, that Medi-Cal recipients who will fall under the new SSI, SSP levels, will they be under state Medi-Cal rather than being handled at the county? It's important to understand that dynamic.
And I'll just say sort of from the SSI portion of it, but Joseph, please feel free if you want to jump in on any of the Medi-Cal eligibility pieces. But so obviously, if you don't apply for SSI, SSP, you're not going to get on it regardless of what your income is, or if you're not eligible for it for other reasons. So there wouldn't sort of be some, just because the income level is going up doesn't mean there's some automatic shift over from the A&D program into SSI, SSP. Now, if you wanted to apply for SSI and you're newly eligible for it because you're under the income limit, you would be shifted onto SSI with Medi-Cal, because that's like, there's a hierarchy of Medi-Cal, and that's like at the very top of it as one categorical, not categorical, I'm like saying mega programs or whatever. It's one of the high, it gets you on first, right? Because you're linked directly to the program. So that's something that would change, but hopefully people won't feel it in their actual services, or there'll still be Medi-Cal. It shouldn't feel different to the recipient, even though it might have coding differences in the system.
Thanks, Claire. So I think we have gone through the questions, and we have a few follow-up items, and I really want to thank you all for multitasking and putting resources in the chat. And I know, Thomas, you had a lot of links in your slides as well for folks, so thank you for doing that, because I know it's a lot of information. You can't possibly fit it all into this hour, but we really do appreciate you all taking time out of your day and giving us a lot of good information, and we will definitely follow up with you all, and I'm sure bother you for more of your insights at a later date. But thanks for all you do, and thanks for your participation. And I will hand it back to Maria to close us out.
Thank you very much, Athena. And we're just shuffling around our, thank you, Nancy, I appreciate that. Shuffling around our screen here, apologies for that. I just want to thank everybody for joining us today, engaging in such a robust conversation. A huge thank you for our panelists, helping us to kind of weed through what's in the budget, what's kind of coming up, lots of exciting things that we're thrilled to see. And again, thank you all for being here. I do want to highlight that we got some general feedback about our webinar format, and I appreciate that. No, it didn't fall on deaf ears, so we'll continue to improve as we move forward. And I hope you all enjoy the rest of your Thursday and get a long and restful weekend. Thank you.